Hemodynamics is really just the study of how blood flows through the body. So you actually don't have to have a great Swan-Ganz catheter or a flow track. You can really just think through how blood flows through the heart to think about hemodynamics and see a lot just by doing a good assessment on your patient. My name is Leah and we've been talking through hemodynamics, and today we're going to talk about just the understanding of how blood flows through the heart. So all blood enters the heart through either the superior vena cava or the inferior vena cava. So this is how blood comes from the rest of the body. It's been in all these veins and it's returning to the heart. When it goes into the heart, then it's going to be inside the heart and it's going to enter the right atrium. Whenever it goes from the right atrium, I kind of think about valves as like doors of how you go from one room to the other, and then the atriums and the ventricles as like the rooms of the heart. So you have blood and it enters the right atrium. It has to go through the tricuspid valve to get to the right ventricle. Down here in the right ventricle, it's then going to want to leave, so it has to go through another door. And the name of the door is a lot of times what's coming next. So I'm going to go to the pulmonary system next. So this is the pulmonic valve that it's going to go through, and then it's going to go through the pulmonary artery out to the lungs. At the lungs, we're going to get oxygen and we're going to drop off carbon dioxide and then come back into the heart via the pulmonary veins. Those are these right here. From there, we're going to enter the left atrium. Once we're in a room, once again, we have to go through a door to get out of it. So this is going to be, it has a couple of names, but the most common is the mitral valve. It's also called the bicuspid valve into the left ventricle. In the left ventricle, if we want to get out, we got to go through a door. And that door in this situation is going to be the aortic valve, because what's coming next is the aorta. And then this is the big aorta right here. In subsequent videos, we're going to talk about these three branches and what they do and why they're important, but just know that there's three little branches off here, or this big fat one that's going to go, the big fat part of the aorta that's going to go out to the systemic circulation and the rest of the body down below. So this is how blood flows through the body, and it's the first step in understanding hemodynamics. So continue to follow this video series. We'll talk more about hemodynamics. We'll talk more about how the bedside nurse can use just simple assessment skills, even if we don't have invasive monitoring, to understand hemodynamics and how blood moves through the body and how the patient's doing based on that information.